Fever is a common symptom characterized by an increase in body temperature, usually in response to an infection or inflammation. While fever itself is not a disease, it is often a sign that the body is fighting off an underlying condition. Here's some information on fever, its complications, management, and homeopathic medicines commonly used. Pathology of fever. Fever occurs when the body's immune system releases chemicals called pyrogens, which affect the hypothalamus in the brain. The hypothalamus raises the body's set point for temperature, leading to an increase in body temperature. This elevated temperature helps the body fight off infections and stimulates the immune system. Complications of fever. In most cases, fever is a normal response and resolves without complications. However, in some situations, especially in high or prolonged fevers, certain complications may arise. These complications can include dehydration, seizures, especially in young children, confusion or delirium, difficulty breathing, rapid heart rate, and increased metabolic demands on the body. Management of fever. The management of fever aims to address the underlying cause, provide symptomatic relief, and prevent complications. Here are some general approaches to fever management. Stay hydrated. Encourage the person with fever to drink plenty of fluids to prevent dehydration. Rest. Ensure adequate rest to support the body's healing process. Temperature control. Use methods like tepid sponging, wearing light clothing, and avoiding excessive external heat to help bring down the temperature. Over-the-counter medications. Medications such as acetaminophen, paracetamol, and ibuprofen can be used to reduce fever and alleviate discomfort. However, it's important to follow the appropriate dosage instructions and consult a healthcare professional if necessary. Identify and treat the underlying cause. If the fever persists or worsens, it's important to consult a healthcare professional to identify and address the underlying cause of the fever. Homeopathic medicine for fever. Homeopathy is a system of alternative medicine that utilizes highly diluted substances to stimulate the body's natural healing abilities. The selection of a homeopathic medicine for fever would depend on the individual's specific symptoms, modalities, and overall constitution. Some commonly used homeopathic medicines for fever include Aconitum napellus, used for sudden onset of high fever, especially after exposure to cold and dry winds. Belladonna, indicated for high fever with throbbing headache, red face, and dilated pupils. The person may be sensitive to light and have delirium. Bryannia alba, suitable for fever with intense body aches, dryness of mucous membranes, and aggravation from the slightest movement. Ferrum phosphoricum, recommended for low-grade fever, weakness, and lack of energy. It can be used in the early stages of fever. Pyrogenium, considered when the fever is very high, and there is extreme restlessness, chills, and offensive sweating. It's important to note that homeopathic treatment should be individualized, and consultation with a qualified homeopath is recommended for proper diagnosis and selection of the most appropriate remedy based on the person's unique symptoms. It's always crucial to consult a healthcare professional for the diagnosis and management of fever, especially if the symptoms are severe, persistent, or accompanied by other concerning signs.